One more note on elections. April 22nd is the deadline to pre-register to vote. If you miss that cutoff, don't worry. You can still register in person at your polling place on election day, or if voting early in person. The deadline to request a mailed absentee ballot is Friday, May 6th. Primary election day is Tuesday, May 17th. Joining me to discuss efforts to shore up Idaho's child welfare system are Cameron Gilliland, Family and Community Services Administrator, and Julie Sevchek, Family and Community Services Program Specialist for foster care at the Idaho Department of Health and Welfare. Cameron, I wanted to start with you. Thank you so much for joining us today. Can you tell me how caseloads changed during the pandemic?
So I wouldn't say that the pandemic changed our caseloads. What really seemed to change our caseloads was the economy and maybe what you would call the great resignation that a lot of organizations are seeing, a lot of people leaving. But it has had an impact. We have had several social workers leave and for various reasons. And as they've gone, their cases are taken up by other social workers and causing a little bit more stress and maybe even causing some more turnover. So we've actually seen about a 30% turnover in the last year, which is high for us. And so we've been struggling to replace those folks and also to cover the workload. So we've done a number of things to do that over the past year.
I know that a number of state agencies in Idaho have lost employees because of a combination of pay and the cost of living. What are the factors for social workers? Is it just burnout, or is it pay as well?
Well, I think pay plays some part in it. Everybody is kind of looking to make more nowadays with inflation and everything, but really I look at the exit interviews for people who leave, and the number one reason is stress. And so child welfare, social work is stressful. It's one of the most stressful jobs you can have, as you can imagine. And so as people have left, they cite that stress and that burnout. And we had burnout before this. It seems to be a little bit more severe now, and it was made more severe probably by the pandemic and the difficulty with getting to kids and that sort of thing, as well as families becoming a little bit more isolated during the pandemic with children not going to school. And so when children aren't at school, teachers don't see them as much. And so sometimes things go on a little bit longer than they would have if children had been at school.
As far as issues of alleged neglect or?
Yeah, educators are one of our primary referral sources. And so my wife is a teacher, and teachers see children and they see what's going on in their lives. And so if they see things that are concerning, they will make a call to us. And so we'll go out and investigate that. So I think that's one of the things we were missing during the pandemic.
And there's also the question of recruiting and retaining foster families as well. And our friends at the Idaho Capital Sun, especially reporter Kelsey Mosley Morris, she's done a fantastic job reporting on the shortage of foster families in Idaho. What are the factors in that shortage?
So there's a lot of factors at play. The pandemic has been one of them because it has been difficult for families to make a decision to bring additional people into their home. We have some foster families who have individuals who are at higher risk, and so they have to be careful. So that has been
as far as introducing new people
and children who are going to be interacting with people in the community because they will be visiting with their parents. And so having them come back after visiting was a challenge for some of our families. The economy is another issue. One of the things that we talk about is families being able to be financially stable on their own without any assistance from a foster care reimbursement, but also having enough space in their home to care for additional children. So it's difficult to ask a family to take in additional children when their home is not large enough to accommodate that. And with the rise in inflation and the rise in housing costs, especially here in the Treasure Valley, that's made it difficult for families to be able to take more children even though they would like to. They can't afford to move to a larger home.
There are a number of complex issues that you just mentioned, and there's no one single answer to fix all of those problems. Right. But after some of that coverage came out about the shortage of foster families, are you seeing an uptick in families inquiring about becoming foster parents.
So we are seeing an uptick in our inquiries, and one of the things that I really attributed that to recently is when we have a media opportunity to talk about the current situation, we see a dramatic incline in the number of calls to Idaho Careline, which is the easiest way to find out about becoming a foster parent. So typically the week after we have a media experience, we'll see almost double the number of calls. And the nice thing about that is that when families inquiry about becoming a foster parent, it's not necessarily that that day and that moment is when they're prepared to begin becoming a foster parent, but it's when they start gathering information. The more information they gather about what it means to be a foster parent, making the decision about, am I ready to be a foster parent? It may be 6 months or a year down the road that we actually see them become licensed, but they're more prepared to become licensed because they've started talking about it.
And for families who are interested, how do they contact the Idaho Careline?
So they can call 211. They can also access that online. Our application is also online on the department's website. We also partner with Idaho, Fostering Idaho, and there is a website for them as well, fosteringidaho.org, where there's additional information. But if you go to the department's website, we have an FAQ section that really provides quite a few answers about what would it mean, what do I need to do to be ready to be a foster parent. Once they have made an inquiry to 211, one of our resource peer mentors will contact them to help answer questions. And I'll explain what a resource peer mentor is. So these are individuals who are experienced foster parents. They're either currently fostering or have fostered in the past. And one of the nice things about using their experience is that they have done this. They know what it means to be a foster parent. So I talk to people about, I've walked alongside foster parents for about 20 years out of my career. I haven't been a foster parent. So when you talk to someone who really understands what that is like, and especially what that first placement might be like, it really helps them to decide, is this the right time for me?
And it's certainly more than providing a place to sleep and food to eat for these foster families.
It really is, yeah. They really bring these children into their home and they love them and care for them. And the other part is they learn to love and care for their parents as well. We really ask foster parents to engage with and build relationships with birth parents.
You know, I want to talk about some of the difficulties that foster families face, and certainly a lot of them are emotional. Some of them are financial, though, however, and that's something that the legislature did address this past year.
Yeah, we were happy that the legislature passed our request for increased foster parents' maintenance rates. And so our rates went up between 30 and 60% for foster parents. And Idaho had the lowest rate in the West as far as foster parent rates go, and now we're about in the middle. And so the rates went from about $400 to $700 for children to about $600 to $900, and the rates are distributed according to child's age, and they're based off of studies that show how much it costs to raise kids. So we're real happy that that happened, and the legislature was really forward thinking in that. And we think that'll take a burden off of foster parents because they do provide so much. They shouldn't have to also provide money on top of that. So we think that that's going to be enough to be good maintenance for those families.
That's on the foster family side. Back to the social worker and IDHW employee side. Is there anything more that the legislature could do to help with the employee recruitment and retainment issue?
Well, they've done a lot this year. So in addition to the normal pay increase that the legislature does, which is a 3% this year, they also give us a targeted 7% rate increase for some of our social workers, which I think will help out a lot. That's really important for our folks. So overall, it'll be a 10% increase for some of our social workers, which I'm hoping will retain them. That doesn't happen until July, so we're not sure yet how that will impact, although they know it's coming.
You know, when you have a shortage of social workers in one part of the state or statewide, ultimately, how does that affect the children who are in the system?
Well, it has impacts for children and for foster parents, frankly. What has occurred is everything kind of slows down. What happens when a social worker leaves is their cases are given to everybody who's left. So everybody has more work to do, and they're just not able to do as good a work as they would have with more staffing. So I would say our social workers want to do great work, and with the limited staffing, they're just able to do good work. And so what that means for children is really it just takes more time for things to occur. So you want cases to move along. You want children to either be reunified with their families, or you want them to move to foster care and then maybe be adopted. Well, it takes a social worker more time to work with the families, the birth families, and either to find that they're going to be able to return those kids or that they'll have to move along. And so we can't see them as often, we can't see the kids as often. It just slows everything down, and we can be more efficient and better with full staff.
And recently there has been more of a conversation in some political circles and one recent high-profile case in which people thought that Child Protective Services had overstepped its bounds. That resulted in a number of everything from posts online to protests. And is that something you're concerned about affecting social worker recruitment and retention?
Well, it has received a lot of attention, and you know that social workers are thinking about that. The social workers are motivated by the good they can do. And I think as they come into contact with the child welfare program and do that work, they recognize the good that's there. And I haven't met a social worker who's left us or who's with us who doesn't feel like they're doing great work. And what greater work can you do but to help children, really save children or save families? It is just a tremendous job. It's hard, but I just have a ton of social workers that I've talked to, that I've received information from, that just tell me how much this means to them. And when they retire or they move on, even those that leave us are just really feel like they've done great work and lasting work. I mean, what better work could you do?
We have about a minute left, but I'm wondering, when it comes to recruiting families, what are the biggest needs right now?
Right now, our greatest need is for families who have the skills to help to manage children who are older, so our ages 12 to 18, who may have some mental and behavioral health issues. So we're really looking for families to help support those youth, as well as families who can care for sibling groups, like we were talking about, those higher number of children and how many children can you have in your home. So we really, whenever possible, we keep siblings together, but that can be challenging right now.
Are there enough supports for more challenging cases for foster families who take in those children?
We could do better, and we try to. We're very clear with our foster parents what they're getting into and who's coming to them, which has kind of led to some difficulty placing. We do have a treatment foster care contracts coming into place here later this summer, and we're thinking that will help fill the gap where they'll get more training and more experience to be able to handle those tougher cases.
Well, we'll have to leave it there. Thank you both so much for joining us today and talking about this critical topic, and thank you for watching. We'll see you next week.